Do you experience persistent discomfort in your legs and feet? Do you have the urge to stretch constantly? Do your symptoms get worse at night and even disrupt your sleep?
Yeah, but why is this happening to me?
Restless leg syndrome is a central nervous system disorder caused by an imbalance of dopamine and low iron levels. Dopamine, that is important for movement, typically decreases at night and can cause symptoms to appear during sleep, while iron is important for the production of dopamine.
RLS affects 2 to 3% of the population, and there's no cure.
Okay, so what can I do about this?
L-Dopa and iron supplements are the primary forms of relief.
Other methods of relief include massaging one's legs, stretching, pacing, walking, or jogging, reducing the intake of alcohol, nicotine, and caffeine, a regular sleep schedule, and transcutaneous electric nerve stimulation, which is the application of a current to one's legs.
Sleep apnea is defined as pauses in breathing during sleep. Central sleep apnea is caused by a lack of respiratory effort. The mechanism in the brain that monitors the levels of carbon dioxide fails to maintain an even breathing rate. Obstructive sleep apnea is caused by blockage in the breathing airway and accounts for almost 85% of all sleep apneas. As your muscles relax during sleep, your central airway becomes smaller and prevents normal airflow. Symptoms of sleep apnea include excessive daytime sleepiness, snoring, abrupt awakenings accompanied by shortness of breath, difficulty staying asleep, morning headache, frequent urination at night, and awakening with a dry mouth or sore throat.
I'm always tired at work. I sleep so many hours and I'm always tired. Am I at risk for any problems?
Sleep apnea is considered a serious medical condition. Cardiovascular problems are the most serious risks associated with sleep apnea because small drops in blood oxygen levels increase blood pressure and place strain on the cardiovascular system, which can be fatal, especially in individuals with heart disease. Other risks include daytime fatigue, which has been shown to produce difficulty concentrating and poor sustained mental effort. Also, sleep apnea can place a lot of stress on your sleeping partner because of the disruption caused by snoring. A continuous positive airflow pressure device, or CPAP, enables one to have a good night's sleep by preventing the collapse of one's airway during obstructive sleep apnea.
Thanks, CPAP.
Do you have difficulty falling asleep at the beginning of the night? Do you have difficulty returning to sleep if awoken during the middle of the night? Do you find it hard to maintain your sleep because you're easily disrupted? Have these symptoms lasted anywhere from several days to several years?
Yeah, what's going on?
You're probably suffering from insomnia. There are 3 distinct types of insomnia if you have difficulties initiating or maintaining sleep. But you must first understand that insomnia is a symptom, not a standalone diagnosis or disease. Symptoms can range in variance and severity. Severity is primarily based on the duration of your symptom. The 3 types include transient, which can last for days to weeks, acute, which can last for 3 to 6 months, and chronic, which lasts for years at a time. Insomnia can cause bouts of increased alertness, muscle fatigue, irritability, impaired social interaction, difficulty with memory, poor concentration and focus, and even hallucinations. Treatments include cognitive behavioral therapy, keeping a regular sleep schedule, stimulus control, relaxation therapy, sleeping tablets, sedatives, benzodiazepines, melatonin, and antidepressants. High dependency on medication can result.